Canada's opioid crisis has presented major challenges for health officials in the country, including right here in our city. And a new report released today says despite the warnings, the number of doctors prescribing these potentially dangerous drugs is on the rise.
Is prescribed OxyContin for a fall down a flight of stairs onto a concrete landing. And for that injury, she was prescribed OxyContin without any real consideration or collaboration of other methods of care that could have and should have been provided for her.
Donna May's daughter, Jack, overdosed in 2012 at the age of 35. She says her daughter was prescribed a powerful painkiller without much consideration for other options.
It was just simply, within 5 minutes, oh, you've been banged up in a bad fall, and let's solve your pain by writing a prescription.
Ontario is in the midst of an opioid crisis, one that health officials have been struggling to combat. Despite the worries about opioid addiction and overdoses, a new report says patients are being prescribed more of the painkillers.
I don't think we have a clear answer to why this is happening. What I think we do know is, though, it speaks to the complexity of the problem.
A study by Health Quality Ontario says almost 2 million people filled out prescriptions for opioids between 2015 and 2016. That's 14% of our province, or 1 in 7 people. To compare, between 2013 and 2014, there were 10,000 fewer people who were prescribed opioids.
I think what our report clearly indicates is that the profession or the healthcare system is a major source of opioids into society, and we need to address it.
In one way, it's consistent what we've already known, where Ontario and Canada, quite frankly, has one of the highest per capita rates of opioid prescribing in the world.
Ontario Health Minister Eric Hoskins says he, along with the provincial overdose coordinator, have reached out to every doctor, dentist and nurse practitioner about overprescribing opioids.
Outlining a number of issues, reinforcing the importance of appropriate prescribing, asking for their support to ensure that they are following best practices.
The authors of this report say they hope it brings political leaders, health regulators, and professionals to develop one solid solution to address the growing opioid crisis.
Everybody's got a role to play. I think all levels of government have a potential role to play. I think frontline providers and physicians and others who prescribe absolutely do. There's absolutely a role as well to think about the appropriate role of advertising by pharmaceutical companies.
We need better policing on that end, and we need a better education to our medical system so that the prescriptions are not so easily given out.
Now, if you do want to read that report, you can find a link on the full report on the rise in opioid prescriptions on our website, citynews.ca.